Hello ladies and welcome back to my channel. My name is Aisha, aka Nurse Aisha. Those of you that are new to this channel, welcome. Please don't forget to hit the subscriber button, like, comment, and help us make more material. Today we're going to talk about early motherhood and the struggles of early motherhood from a new mother. We're going to start with the most important part, coming home with your baby and starting the breastfeeding challenge. Exactly, challenge. It's challenging enough being a new mom, coming home with a baby. So you have to learn their patterns, their behavior, their needs, when, how, what cry means what. At this point, you've probably attended so many classes telling you what to do, what not to do. But the problem is, there is no manual. And the challenges that you face, especially if you've never had children and this is your very first child, sometimes even your second child can be challenging. You might have had it easier with your first child, but with the second child, now it's a challenge. You're tired, you're sleep deprived. So let's talk about that. Breastfeeding to start with. So if you have never breastfed a baby, you might have attended antenatal classes to learn how to get your baby to latch, what position you should be in when you're breastfeeding, how long you should breastfeed. As you're sitting there alone with your baby, you're going to notice that it might be a little bit different. If you decide to exclusively breastfeed, this can also be challenging. But you might decide to use formula for your baby. You might even decide to give your baby a dummy. In the beginning, you might feel that all you're doing is breastfeeding. This time is very, very tough for many mothers. I'm not yet a mother, but I've nursed and taken care of many mothers. This is the time when the tears come falling down. You do not have time for yourself. All you need to remember is that this shall pass. Your baby will get used to the feeding times. You will get used to the feeding times. You have to breastfeed at night because this is the time where you're actually producing the milk. That's just the way it is. Now, 6 months is what is recommended to breastfeed. Now, if your baby needs more than just exclusive breastfeeding, you might want to add. But you have to listen to your body and also get to know your baby, what that baby needs from you. So you shouldn't be afraid that you are not producing enough milk for your baby, because almost all mothers are capable to produce enough milk for their children. It's all just depending on how often that you're breastfeeding. If you're breastfeeding often, that also stimulates the production of the milk in the milk canals. Now, problems that might occur, that might make you feel less of a person, maybe the leaking of the breast. You can use breast pads. Just make sure that you change this often so you don't get an infection. And then there's the mastitis. Your breasts feel like rocks and they're heavy, they hurt, they're swollen. What you need to do is make sure that you warm up your breasts. You can get under a warm shower and maybe press out the milk. Make sure you're gentle. You can get someone to help you with this. Or if you feel like you don't have anyone that can help you and your help is, just check in with your midwife. Call. There's so many women out there that are knowledgeable about breastfeeding that do this for free. You can just call them and ask them what to do. If you are not able to get your baby to latch onto the breast, there's also little plastic dummies that you can put directly on your nipple to help the child latch onto your breast. This is all depending on where you are, what you have access to, so this is not for everyone. If you're a single mother and you absolutely do not have this help accessible to you, you can read about it. But make sure that you are on the right channels to get the right information and get the information that is applicable to your situation. Now, if you choose not to breastfeed, that's also okay, because there's some women that just cannot breastfeed, probably don't want to, or they have medication that they're on. It could be conditions that could stand in the way of breastfeeding. So this is where we need to be very kind to each other. not judging each other. There are so many benefits to breastfeeding. They can be protected from different bacterial environments and all of that. Yes, it's very good to breastfeed. Now, if you have to snap back really quickly and go back to work, that's also okay. You can pump. I know the breast pumps are very popular and there's so many different ones and they're making them really chic these days. It's like wearing a bra and you're pumping at the same time. It's amazing. It's amazing how many different solutions there are out there. You don't have to feel as though you're just a milking person. And if you cannot afford a breast pump, sure that there are different solutions depending on your situation. So when it comes to lifestyle and lifestyle change, your lifestyle should not really change radically because you're a new mom. In fact, what you should do is incorporate your newborn into your pre-existing lifestyle. If you're a very active person, make sure that you get this to work for you with a newborn. Get help or take your baby with you. Make sure that that works for you so it's not overwhelming. You don't need to come from a very active lifestyle and then just settling at home because you have a newborn. Keep your lifestyle the way that it is, but incorporate your baby into it. Now, if there's a problem with a lot of weight gain, the best way to lose weight as a new mom is breastfeeding. Breastfeeding gets the weight off. Now, if there's a little bit of weight left after you finish breastfeeding, it's also recommended physical activity for you to get back in shape, but also to stay mentally healthy. So when it comes to sex after delivery, this can also be tricky. You have to be kind to yourself. If you're experiencing low libido, that's okay. Just talk to your partner. If it's an issue of dryness, there's always lubricants out there that you can use, like olive oil or coconut oil, if that's the problem. If you're feeling not quite like yourself, you've gained weight and you don't feel sexy enough, work on that. If you've had a natural birth or you've had a C-section, your limitations of exercise depends on that. So physical activity can also help to maybe get a new thinking for you to get back into the game of intimacy. Intimacy is very personal. So if someone is back on the horse, so to say, after just a month, that is up to them. But always connect and speak to your partner about the problems that you're having. Aside from breastfeeding, there's so many social challenges out there. The snapping back, getting back in shape as soon as you've had the baby. Probably society is pressuring you for another baby. Your mother-in-law is questioning your ways of mothering this child. When you're ready, you can have that second child. When you're ready, you can have sexual intercourse again. Now, make sure that you get contraceptives after you've had a baby, because you can get pregnant as soon as 3 weeks after you've had a baby. This is all to make sure that you don't exhaust your body with yet another pregnancy shortly after you've had a baby. So now you have to snap back, you have to get back to work. I live in a country, I think, where we have the best time for us as mothers to get back in shape and to get back to work. I believe Sweden is one of the best countries to live in as a mother. You get maternity leave for a whole year. This gives you time to bond with your baby, time to think about your situation if you want to go back to work or you want to have another baby. Now, I know other countries, my Ugandan sisters, my sisters in London and the UK, you only get 3 months of maternity leave. That is a very short time to my liking, but it is what it is. So the social challenges that we face as mothers to get back to work can be so tiresome, but we get through this as mothers. So motherhood should not be only about pain and suffering and breastfeeding schedules and diaper changing. Motherhood should be beautiful. First-time mothers, single mothers, multi-mothers, mothers-to-be, make sure that you get into this with a positive mindset. It should not be feeling tired all the time and feeling like everyone is against you. They're not against you. They're trying to help most times. Give yourself time to recover, to get back into shape. This is the greatest gift that you can give yourself. Now, if you only have 3 months of maternity leave, make it work. Get your team around you. Get your mother-in-law to help out. Get your own mother to help out. Get your sisters, your friends. Make sure that you give yourself time to heal. Give yourself time to get back into shape. Another challenge that is common for new mothers in early motherhood is mental health. Now, we have already discussed postpartum depression, and I'll put the link in the description below for more information. But it's very common for mothers to experience anxiety and a lot of hopelessness. This is due to a lot of stress, pressure, but also pressure within you. You put so much pressure on yourself as a mother to be a good mother. You don't feel like you're enough. But if you experience long-term hopelessness, loss of appetite, you do not have interest in your baby, you're crying all the time, it's very important that you talk to your doctors and your midwife so that you can get a diagnosis and really get to the bottom of this. Now, the month May is the mental health month. So I really want to emphasize on mental health for new mothers. Make sure that you go back to your doctor and talk about this. What you need to do is to put yourself out there again, ladies. Connect with others. And if this is not enough, there's doctors there that can help you with this. Do not close yourself in, because this is when the thoughts take over. Just make sure that you make sense of the thoughts that are going on in your head. Are they true? Are you really not a good mother? It's not true. It's just in your head. It's just you putting so much pressure on yourself. The best thing to do is stay active. This helps you get out of your thoughts and you can focus on other things. You can get hobbies to do with your baby. Going swimming with your baby. There's so many activities that you can do. In that way you can connect with other mothers and realize that this is not only a problem for you specifically, but others experience this just on different levels. So ladies, when it comes to mental health, please do not stay quiet. Verbalize it so you can get the help that you need. So to all of you maternal warriors out there, good luck, and make sure that you give yourself time. You will get through this. Thank you for watching, and I'll see you in my next video.